The weapon systems of today and the future will produce casualties that we have not seen ever. The Navy needs to be prepared to provide the care needed to the sailors and Marines that will be engaged in potential large-scale combat in the future.
The PMS 408 Expeditionary Missions Program Office is part of the Naval Sea Systems Command. We are responsible for acquiring, building, and sustaining ships, submarines, and systems for the Navy. When we stood up the Expeditionary Medical program, it was a matter of applying those same acquisition practices to Navy medicine.
We're identifying all the components. So think of like, we need an X-ray, we need dental, we need surgical tools. We do that and we figure out how to pack configure it that it's deployable, because you can go out and buy something, but it was designed to stay put within a hospital. We have to find something that could get packed up, go someplace, and operate in probably a pretty austere environment, meaning that extreme temperature variance, weather scenarios, high altitude, things like that.
That will be used in a wartime environment the likes that we haven't seen since World War II. It's imperative that we are able to treat in the field and afloat patients in small numbers as well as mass casualty environments and keep them in the fight for as long as we can without having to transport them all the way back to the continental U.S.
So the Role 3 capability is essentially a field hospital. So we have some critical care, some intermediate care, ancillary services to include lab, imaging, things like that. So picture MASH.
Big Navy identified the need of treating casualties at sea. USNS Cody is a fast transport ship that basically provides expedite care to the theater. So it's the first ship on any class, on any history, that can actually do this set of missions for the Navy and be operational in an amount of hours to start treating medical capabilities. So it is amazing because the Navy overall has never brought a medical modular capability aboard any ships.
So we work with our medical service providers, the doctors, the nurses, the corpsmen, to understand the tools that they need and the gaps and risks that they experience doing their job in some of the most austere and challenging environments. Then we work with industry, manufacturers, academia, the greater research and development community to identify those technologies that are able to provide that suitable capability for that doctor to perform that surgery or that corpsman to address that sailor's wound at the point of injury.
Making sure that our sailors and our Marines have a solution set, not just cool stuff in the theater, but cool stuff that we can maintain, that we can resupply, that's going to be readily available for them, not just now, but in the future.
Ensuring that our sailors and Marines are going to have the best level of care in the field, and it's going to be aligned to not what we're facing yesterday, but what we'll face tomorrow.